about people with serious illness. It's patients and families who are affected by illnesses that are likely to shorten the amount of time that they have. And it's not only that you have this condition, but it's also impacting the way you move about your day, the quality of time that you have, or kind of importantly, the quality of time that you have with the people who care for you and who love you.
Patients who have serious illness are vulnerable in a particular way. You could say that the fact that they're experiencing the stresses of being ill and the stresses that places on their family and the burden that imposes on them places them at high risk of having suffering. And part of what we're trying to do is address that suffering by improving the communication that they experience from the clinicians they encounter along the way.
I think it would be naive of us at Ariadne to say that we can eliminate all suffering with serious illness, but I think we as a healthcare system can really improve how we care for people and do a better job of talking with people about what their values and goals are. Hi, I'm Rachelle Bernacki. I'm the Associate Program Director of the Serious Illness Care Program at Ariadne Labs. I'm also the Director of Quality Initiatives at Dana-Farber Cancer Institute in palliative care, and I'm an assistant professor at Harvard Medical School.
My name is Justin Sanders, and I'm the Assistant Director of Innovation at the Serious Illness Care Program at Ariadne Labs. I'm also an attending physician in adult palliative care at the Dana-Farber Cancer Institute and Brigham and Women's Hospital. And then finally, I'm an instructor of medicine at Harvard Medical School.
I'm Josh Lakin. I'm an associate faculty member here at Ariadne Labs. I'm an attending physician in palliative care at Dana-Farber Cancer Institute, Brigham and Women's Hospital, and I'm a clinical instructor at Harvard Medical School.
The Serious Illness Care Program takes a really unique and important approach to caring for patients with serious illness. We need to take a systems approach to making sure that we identify the patients who are most in need of good communication around their goals, values, and priorities. We need to train the clinicians to be able to do that, and we need to activate the system to trigger them, to support them through coaching so that they can really be best placed to provide the best communication possible for these patients.
I think what's crucial in serious illness care is that we have tools. A lot of clinicians don't know what to say to their patients, so our serious illness conversation guide really decreases the anxiety on the clinician part of how to open a conversation with a patient with a serious illness about what they really care about.
If the overwhelming and dominant feeling for a lot of people with serious illness is this loss of control, the way that this program is set up is to try and give both the patients and the clinicians and the healthcare system as a whole as much control as we can over a situation. And the core to doing that is starting to understand what's most important to the person in front of us as clinicians.
Communication shapes every aspect of a person's experience in healthcare, and it's particularly important for those who have serious illness, in part because it's important that they understand what's likely to be ahead so that they can make decisions about how they want to spend their time and the things that they want to focus on, and that we can adapt our treatments to meet their goals and the things that are important to them.
Our palliative care clinicians are wonderful communicators. They're generally wonderful teachers. They don't know how to do system change. And so we identified that as a gap. And we really want to support those leaders in doing that system change at their institution because it is hard. My Sojourns project was to develop the serious illness community of practice. And it's an online community. We have over 1,400 members of the Serious Illness Community of Practice. We have webinars, videos, all of our scholarly articles, all of our materials, including the guide, a clinician training reference, and we've had over 20,000 downloads of our materials. So it's just been phenomenal.
What I've been doing as a result of the Cambia Sojourns Scholar program is working to try to understand how to measure one of the most important outcomes of the care that we provide in healthcare, which is goal concordant care, the care that we provide that matches the things that are important to patients. What I'm trying to understand by interviewing caregivers of patients from African American and white communities is how communication impacted their experience of care at the end of life, and in fact how much it impacted the degree to which they believe the care that they received matched the care that was important to the patients.
For the project, as I kind of recognized as I was thinking about interprofessional work in my specialty space, I was also realizing that I hadn't done a very good job with it as I did the primary palliative care work, as I was helping primary care doctors and nurses and social workers to try and do this. I hadn't taken the time to really sit down with them and talk about this and think about this. And what I saw them doing was getting kind of burned out and struggling with this work. And at the same time, I saw some of them kind of doing it as teams. And I hadn't really instructed them or taught them what I had learned in palliative care. And they obviously do a lot of team-based work as part of primary care naturally. So the first step with the project was to go learn from people who've been running the serious illness care program in 5 years and ask them, so what is this like for you in teams? What works for you in teams? What's not working for you in teams? How do you do this program? And the goal from that really was to learn from them. Without a doubt, the most rewarding part of the Cambia program for me has been the opportunity to get a chance to listen to meet, to engage with, and to work with so many different people, professionals, and very inspiring people who are all kind of struggling away in this palliative care space. And it's been so kind of rejuvenating and inspiring to see them all at work and watching all the different ways in which they are engaging in this work, energizing us as a community, and also kind of, in some ways, fearlessly tackling some of the biggest challenges that I'm oftentimes afraid to even think about going for.
The thing that I'm most interested in contributing to the field of palliative care is some moral leadership around the care of patients from underserved and vulnerable communities. So while we think of seriously ill patients as vulnerable in some way because they have a life-threatening illness, there are those patients in our society who are even more vulnerable as a result of the communities from which they've come, the things that have happened to them in life, and the things that they've done. I'm troubled by the fact that people get different care because of something so simple as the color of their skin or because of where they grew up.
I've been really honored to be part of the Cambia Sojourns Leadership Scholars, and I think that one of the things I've learned over the past several years is really how important leadership is. By creating a cohort of fellow leaders, there's so much more that we can accomplish together than separately, and the ability to foster that has just been phenomenal.